Actifif Nic Overdose and Side Effects Disclaimer: this information is for general knowledge and informational purposes only, and does not constitute medical advice. It is essential to consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. If you suspect overdose symptoms, Actifif Nic contains two main active ingredients: phenylephrine hydrochloride and triprolidine hydrochloride. Each ingredient can cause separate overdose symptoms. High blood pressure: a sudden increase in blood pressure, which can lead to dangerous complications like brain hemorrhage. Overdose symptoms: headache, severe headache, often accompanied by dizziness. Palpitations: irregular rapid heartbeat, which can lead to arrhythmias. Seizures: uncontrolled seizures, posing a danger to the patient. Ventricular tachycardia: irregular heartbeat, potentially leading to heart failure. Overdose symptoms: bradycardia: abnormally slow heartbeat, which can be dangerous for the patient. Paresthesia: numbness, tingling, burning sensations, usually in the hands and feet. Drowsiness: excessive drowsiness, potentially dangerous when driving or operating machinery. Overdose symptoms: headache, often accompanied by dizziness. Fatigue: unusual tiredness, reduced energy levels. Impaired coordination: difficulty coordinating activities, posing a risk while driving or operating machinery. Management of overdose: stop medication, stop using Actifif Nic immediately. Induce vomiting: if the patient is conscious, induce vomiting to remove the medication from the stomach. However, do not induce vomiting in patients who are unconscious or at risk of aspiration. Management of overdose: administer activated charcoal, give the patient activated charcoal to absorb any remaining medication in the digestive tract. Symptomatic treatment: treat symptoms based on the patient's specific manifestations. Management of overdose: high blood pressure, use alpha-adrenergic blockers like phentolamine 510 mg, intravenously, repeat the dose if necessary. Seizures: use appropriate anticonvulsants. Arrhythmias: use appropriate medications to treat arrhythmias. Management of overdose: respiratory support, monitor the patient's respiratory status and provide respiratory support if necessary. High blood pressure: use alpha-adrenergic blockers like phentolamine 510 mg, intravenously, repeat the dose if necessary. Seizures: use appropriate anticonvulsants. Management of overdose arrhythmias: use appropriate medications to treat arrhythmias. Respiratory support: monitor the patient's respiratory status and provide respiratory support if necessary. Hemodialysis: hemodialysis is usually not effective in cases of Actifif Nic overdose. Management of overdose: high blood pressure, use alpha-adrenergic blockers like phentolamine 510 mg, intravenously, repeat the dose if necessary. Seizures: use appropriate anticonvulsants. Arrhythmias: use appropriate medications to treat arrhythmias. Management of overdose respiratory support: monitor the patient's respiratory status and provide respiratory support if necessary. Common side effects: drowsiness, feeling sleepy, tired. Headache, dizziness. Fatigue, unusual tiredness, reduced energy levels. Impaired coordination, difficulty coordinating activities. Uncommon side effects: blurred vision, blurred eyesight. Urinary retention, difficulty urinating, reduced urine output. Dry mouth, nose, throat dryness, and irritation in the mouth, nose, and throat. Chest tightness, feeling short of breath, tightness in the chest. Rare side effects: agranulocytosis, decrease in the number of granulocytes in the blood, increasing the risk of infection. Neutropenia, decrease in the number of neutrophils in the blood, increasing the risk of infection. Rare side effects: thrombocytopenia, decrease in the number of platelets in the blood, increasing the risk of bleeding. Note: side effects can occur in anyone using Actifif Nic, but they are more common in individuals sensitive to the drug's components. Report any side effects to your doctor or pharmacist for advice. Rare side effects: do not stop using Actifif Nic without your doctor's consent. Additional information: Actifif Nic is a prescription medication, so it should only be used as directed by your doctor. Always read the instructions carefully before using the medication. Store the medication as instructed by the manufacturer. Do not use Actifif Nic that has expired. Additional information: note this information is for general knowledge and informational purposes only. Consult with your doctor or pharmacist for the most accurate information about Actifif Nic.